Hello everyone. So today's question is, which of the following structures help in collections of ovum after ovulations? And your options are internal os, fimbriae, ampulla and isthmus. So before answering these questions, let's take a look on this picture and just level those name which mentioned in the options. So the first option is internal os. So where is your internal os? Here in this portion, and that is exclusively responsible for keeping the fetus inside this uterus. During pregnancy, once this internal os gets open, this fetus will come outside through the vagina. So that is internal os is not the answer. Now coming to the ampulla. Here is your ampulla, one of the part of the fallopian tube, and that is exclusively responsible for fertilizations of the sperm with the ovum. That's why ampulla is also not the answer. Now coming to the isthmus. In this whole picture, there are two isthmus. One is the part of the fallopian tube, also call its physiological sphincter, okay, and another one is your lower border of the lower part of the uterus, and that is also not responsible for your taking up the ova from the ovary. So isthmus also not the answer. Now coming to the fimbriae, the last part of the fallopian tube is infundibulum. Now this infundibulum is having small finger like projection. One of the fimbriae becomes elongated and connected with the ovary, and that is called ovarian fimbriae, okay, and this ovarian fimbriae is responsible for taking up the ova from the ovary and sending it towards the ampulla for fertilization process. That's why your answer of these questions is the fimbriae. That's all about